Good afternoon, everybody. It is Wednesday, and we are here at our live stream this afternoon on May 12th. What a busy day today it is. We have a couple of announcements for you, and I am so happy to have our guest on today. So we'll get to that in just a moment. First and foremost, I would like to remind everybody that tonight is the annual CDC, the Community Development Corporation's annual meeting. It will be this evening, and you can attend virtually or in person. So there are two ways that you can do that. And if you go to the Pagosa Springs CDC website, pagosaspringscdc.org, you can get the login information and the agenda right on the website. And then tonight we will also be at the Tennyson Building Event Center. And I'm telling you, folks, if you haven't been out there in a while, what a fabulous job they have done in making that into a really, really nice event location. So I can't wait for everybody to see that. The meeting this evening starts at 5:30, and it is open to the public. So we hope that you'll be able to attend this evening. We'll have a broadband report. We'll have the year in review. We'll also have a couple of different reports from Region 9, the executive director, the town will do some reporting, and so will the county. So a great time for people who want to catch up or want to be involved in economic development to please attend either virtually or in person this evening. Now, well, I've had several businesses call me and say, Mary Jo, PPP is out of money. And yes and no. So for you businesses that are still looking for PPP funding by your traditional bank sources, yes, the system has been closed. However, the SBA set aside some money for some specially designated banks. And when I say that, there's a designation called CDFI. And these banks have to go through some additional certification. There's not a lot and in this area, much less across the United States. So it's an extra step, and it's an extra very important certification for some of these banks. And once again, it's called CDFI certification. Well, the SBA has held some money aside for these CDFI certified banks. The one location right now that you can still apply for monies is First Southwest Bank, and they are CDFI certified bank, and you can go to the portal that's listed on this screen, and we will have that, or you can go to the First Southwest site, and if you are still interested in signing up for PPP funds, there are still funds available through this portal, through the SBA. So that's really important to know, because not everybody has applied yet. Everybody was under the impression there's lots of money still out there. It's good to go. But the general pot of money, yes, is gone. So you do have to go, or you can pull up a list of CDFI banks. But why would you bank outside our region? So please, if our business community is still interested in PPP funds, that is one area or one bank that you can go to. And we also want to remind our restaurant community that the restaurant recovery program is also open. That opened about a week ago. And so you can look for funds through that website as well. The other thing before we get to our guest is I would like to mention that probably a couple times a month, I get a request for someone interested in buying or selling their business. They want to retire. Not many are moving out, but most people are looking either to retire or just kind of downsize and are looking to sell their business. And I also have people calling me saying, I'd like to buy a business in Pagosa Springs. My question always is, what's your passion? What's your expertise? What are your interests? So two things. If you are interested in selling your business, please make sure that you let me know, because I do have inquiries on a regular basis. But more importantly, there is a 2-part webinar coming up on May 18th and 19th from 9 a.m. until 10:30 a.m. On buying and selling your business. Now, there are several very critical types of businesses that will be facilitating this. We'll have Terrell Peterson, who is a CPA. We have Frederick Zink and Associates, as well as First Southwest Bank. This workshop is presented through the Small Business Development Center, and it is free. And they're doing this through some CARES Act funding. So you can get on this webinar and you can go for 2 days. Preferably go to both sessions because they'll be talking about two different things on both days. Once again, that's May 18th and May 19th, both days from 9 a.m. to 10:30. And you can get that through the SBD website, which is sbdcfortlouis.org/workshops. So sign up for that as well. Well, again, COVID. Where are we? What are we doing? Things are changing. Are we healthier? Are our caseloads better? And nobody can tell us any more or any better than our CEO of the hospital, Dr. Rhonda Webb, who I am so honored that you're able actually to take the time to be with us. But I know you have a crack staff over there. So thank you so much, Rhonda, Dr. Webb, for joining us today on our live stream.
Thank you, Mary Jo, for letting me come and talk to people again. I will say I'm not the expert on the COVID-19 pandemic. We've been partnered throughout this event with public health, with San Juan Basin Public Health. They've been just wonderful in leading us through this. They taught us initially last March the 12th. This when we went into incident command and taught us about that the pandemic was here and we couldn't do anything to stop it. But what we could do, if you'll remember, they talked a lot about flattening that curve to mitigate the effects of it. And that has happened here and much better than in some other areas. In fact, we really didn't have many cases until last summer. And now we are seeing it's highly contagious. It's everywhere. And we are seeing, I think there were 41 new cases in the past week. We've had almost 1,000 Archuleta County residents who have tested positive for COVID, for the coronavirus. Now, as we all know, the majority of people don't get super sick from it. They may not have any symptoms. They may just lose their taste and smell. They may feel like they have a cold almost, or a sore throat, a little abdominal pain, and nothing else, very self-limited. But that minority of people that do get the inflammatory disease or the blood clots from it, or very low oxygen, that end up having to be on permanent oxygen, or that die from the pandemic, there is a small group, but they do exist. And we do what we're seeing at the hospital now is that probably 3 to 5 are seen in the emergency room every day with COVID-like symptoms. They don't all test positive, but we've been having 2 or 3 a day test positive in there. And then at our clinic building, we're seeing people that are symptomatic with COVID, and they are testing positive. They are seen in a special area of the hospital. We call it the Aspen rooms, and they're registered by phone in their car. And then they're brought into a special entrance that has different air handling and can be cleaned in an easier way to help prevent the spread. And they're not in with other people who are at the hospital. So it's not gone. I mean, we usually have 1 or 2 patients in the hospital with it a week. And then about once a week or every other week, we have to send somebody on up to the Front Range because they're too sick to stay in our hospital. I'll remind you that we don't have an ICU here. So this has always been our goal, is to keep the numbers as low as possible, so not to overwhelm our little system and not lose more lives than you have to. And Archuleta County has been, it's been great. We've not had very many. I think there've only been 1 person whose full-time address was here who has died from this pandemic, and so that's good. So that's really where we stand with things. We can treat people with the monoclonal antibody that's designed for people who are not on oxygen. Certain criteria have to be met. You have to be a high-risk person to develop the severe illness or death from it, but not sick enough to already be in the hospital on oxygen. Just testing positive within those first 10 days. If you see your provider, they would screen you, and if you meet criteria, you can come into the hospital, and you just stay a couple of hours, and you get an antibody treatment that can help. It's been shown to reduce death and reduce ICU stays. So keep people out of the hospital, and then we also do treat the drugs from the severe and the sorry, my dog's coming in. My dog's coming to visit.
It's the beauty of virtual.
She broke through the door. Yeah, that's right. And we have to close the curtains. But anyway, so that's where we stand with it. We're seeing it. There's no doubt it's here. It's going to be here until you get enough herd immunity. You either
Sure.
have enough people that have had it, and or that have been vaccinated. And even vaccinated people can get coronavirus. We know that, but they don't have as serious of a course. We know that too now.
So, Dr. Webb, can you talk to us a little bit? Oops, she's gone. Can you?
I had to close the door.
Can you talk to us a little bit about the vaccines, the clinics that are going on, and the importance potentially of people? There certainly has been a little bit of a lull in the demand for the vaccine. Can you share a little bit? Today, as a matter of fact, we have CDPHE's big red bus in the Walmart parking lot. They are going around Southwest Colorado, and today is the day they are in Pagosa Springs. So they are in the parking lot of Walmart doing vaccine clinics. I believe they have Johnson & Johnson and Pfizer available. But can you talk to us a little bit about, the vaccines and
Sure.
where we are right now?
So we have a lot of people who couldn't wait to get a vaccine, myself included. I have family who are frontline in COVID wards, and we've seen enough people at the hospital and read about it to believe in it. So starting in December 16th, I believe, is when our hospital started giving vaccines, and then we've vaccinated more than about 8,000 people, again, working with public health. We ran the mass vaccination clinics downtown. They were organized by our chief of operations. He done this incredible job, and we just stopped doing those a couple of weeks ago. We continue to give vaccine as people do come in and want them. It does need to be scheduled because we give Pfizer. Once you open that vaccine, you have 6 doses, and we've wasted almost no doses. A rare needle break or something like that happened, maybe 1 or 2, but not very many doses. We've been able to get the vaccine into people when they get it. There is a lot of vaccine hesitancy, and I understand that. There is an avalanche of misinformation out there about the vaccines, and it's unfortunate. Vaccines help keep people from dying from certain illnesses, and we've used vaccines forever. I mean, when we were little, we all got our smallpox and our polio vaccine, and that's how polio and smallpox were eradicated. And this has been a challenge because they did develop the vaccines quickly. They still went through the same channels to develop them, but all the testing, the FDA, they just had so many people working on it at the same time. They were able to do it more efficiently. So it didn't take 2 years to get a vaccine. It took a lot less time than that. And so for us, the vaccine is the light at the end of the tunnel. It keeps you in school. It keeps you at work. It keeps you able to do anything you want to. And it just makes you feel safer. So I also, however, am a person who takes flu vaccine, but again, always knowing that the flu vaccine doesn't necessarily keep you from getting the flu. It just makes it less likely that you'll get real sick from it and die from it. And that's true for many vaccines that we use. And so I I'm a big vaccine proponent, and I know a lot of people don't want vaccines, and that is certainly their right to do that. We will continue our masking orders until our masking rules at the hospital, of course, until the governor eases that order and until we see that we have got less spread, because it's still spreading. And
Sure.
again, although the majority of people won't get sick from it, there are those people that are still getting sick from it. I saw on the national news last night a guy in Denver, 38 years old, suffered a severe and debilitating stroke, COVID, and that's just not what you want to see. So.
Sure. And the mask mandate has been extended, I understand, until June 3rd. And
right. It has been.
Yes.
I know people are getting laxer about wearing them, but again,
Sure.
at the hospital, we are under a separate order for us to be able to do elective surgeries. We have to enforce mask wearing, and some people are fatigued about it. I'm fatigued about it. We're all tired. That's one nice thing about these Zoom meetings, is that you don't have to be in a mask, unless I'm in my office, and frequently I am in a mask. But it's hard. I don't think I realized just how hard of hearing I was until people started wearing masks and I couldn't read their lips anymore. But and we're all tired of it. I mean, this has just been a terrible thing for everyone to have to go through. And so we understand that they're getting grumpier and about having to answer the questions about COVID and get their temperature taken before they can come in the building. But we feel like by doing these measures, we're keeping other people from getting COVID, especially those most vulnerable people. And the good news is that another thing is that the most vulnerable people have now been vaccinated. Most of them have been offered vaccine for sure. Our people at the nursing home and the more elderly populations, and they were very grateful for the vaccine, for the mass vaccination clinics. And again, I'll got to give another shout out to public health. They've been just terrific for us to work with. Now they are running their own mass vaccinations, and then they're trying to go into smaller areas too. Just sort of changing the way it's delivered, because there are a lot of people who can't get to a clinic, who can't get to a bus. The single parents are working, and then they've got childcare issues, and so that they're really trying to reach those people that aren't I guess they're called marginalized, the people that can't get in for vaccination. And so we will continue to vaccinate at the hospital and continue to follow the same COVID rules, and hope that, we're a 12-bed critical access hospital, and we've been open since 2008. And many people might not realize that we started, the Upper San Juan Health Service District started in the 80s with our ambulance, and we still own the ambulance. We had primary care added in 2010, and then we've just grown and grown from then. We're a small hospital with a lot of debt. And so, because we're young, so we had buildings to pay for, or still have buildings to pay for. And we only have so much oxygen here. And so we never wanted you don't want to have an ICU. I think the most COVID patients we've had in at one time were 4. And our peak COVID numbers were in November in this state. And in November the 19th, in fact, there were no ICU beds in the state available. And I'll remember that forever, because it's a scary feeling to know that you don't have a place to send a patient who needs intensive care. And we, again, don't have an intensive care unit. Now it's all much better. It's just a little at a time. And so hopefully it'll play on out, and the kids will get to graduate. Well, they get their graduation, they had their prom, and the people can stay in their jobs, and we can continue to go forward. I heard you say earlier on the program about the PPP. Mm-hmm. That is one thing we did apply early for people who are interested, who follow hospital financials. We always run a very tight margin. Rural hospitals are like that. Many, more than hundreds have closed in the past 10 years. And so we continue to have a really tight margin. But right now we happen to have quite a bit of cash. If you follow that in the paper and you wonder, it's because at the beginning of COVID, Medicare gave us about $5 million loan. It's based on how much revenue you bring in, how much they pay you each year. they gave us that loan. It was like at 10%. We knew we would never use that money unless you had to stay open. And all hospitals got that money now, and so that sits in the bank. And now Medicare is slowly taking it back. They withhold other payments, and they'll just slowly pull that money back away from us. We did apply and got payroll protection PPP money early on. However, ours has not been forgiven yet, so that money also sits on our balance sheet. So right now we have quite a bit of cash, and we are very hopeful. We are lobbying with our CFO, Shelley, is terrific, and she spent some time this week with Colorado Hospital Association trying to make them understand that that we are not Kaiser, who had $1 billion profit last quarter, and so that we really need this forgiven too. But because payroll is our biggest expense, it was quite a bit of money. So it's several $1 million. And so it's in a review process too. But we went through First Southwest Bank and we were able to get that money.
Great. Well, it's good to hear. And we know that the hospital is still business as usual. So if you need to schedule a surgery or you need to get some blood tests or whatever, our hospital is still open and doing business. So it's not just about COVID, but it's about the great facility that we have here in our community that is running as normal. We're back to kind of normal. So we share the same problems that every business in our community does. And that is our housing is so expensive now. So trying to find workforce housing, trying to find a workforce that can afford to live in Pagosa is a challenge. And we continue to work with our local, the Pagosa housing partners, and trying to work with the county council and see what we can do to try to get more affordable housing. And there's some movement in that, and we also struggle with lack of childcare. So we're trying. All right, Dr. Webb, thank you again so much for taking the time to be with us today. It's always so informative, and the hospital is such a critical component of our community. And truly, to you and your staff, for what we thought would be a few months, but it's been now over a year. Thank you for all you have done. I have heard nothing, especially in the clinics, people saying, boy, other places need to learn from our hospital and how to do it. So congratulations to you and your entire staff for everything you have done for our community this past year. And if you haven't seen that Heroes series that the Chamber produced on healthcare, our hospital was one of those heroes. So jump on the Chamber website and you can view that video that came out last month. Thank you again, Dr. Webb. We appreciate it. Everybody, thank you for spending some time with us today. Or if you are viewing this at a later time, we appreciate it. Don't forget the CDC annual meeting this evening, 5:30, either virtually or at the Tennyson Event Center. And we'll see everybody next Wednesday. Have a beautiful day out there and a great week. Thank you, everybody, for joining us.